Have you ever wondered what kind of impact breast cancer surgery has on recovery? Do the different types of surgery have a different impact on the ability of women to return to work? If you are thinking about how quickly you can get back to your daily activities after surgery, then this is the video where we will present the research data on the subject. The time taken to return to work has been shown to affect quality of life in breast cancer survivorship. Helping a woman return to her career as soon as she is ready after breast cancer treatment is part of helping her to live more. As doctors, we need to know which breast cancer operation prepares a patient to return to work sooner. Let us look at the data comparing how the different types of operations for breast cancer correlate with return to work. There are two broad groups of surgical treatment for breast cancer. Doctors can perform a mastectomy, which is the operative removal of the whole breast, after which a patient can elect to undergo a reconstruction or not. The other type of operation is breast conservation treatment, where during surgery, the cancer is totally removed with a rim of healthy tissue around it. The remainder of the uninvolved breast is preserved, and radiation therapy is usually recommended after. Mastectomy is the historical surgical modality of breast cancer treatment, and it is still in use today in certain circumstances. However, over 5 decades ago, the gentler operation of breast conservation treatment was introduced after robust research. It has been shown over the same period of time that not only does it offer similar cure rates as mastectomy, there is evidence that survival outcomes with breast conservation may be superior to that of mastectomy. Hence, this panel of experts who convened at the 2025 edition of the St. Gallen International Breast Cancer Conference advocates that women with early-stage breast cancer should be advised that breast conservation surgery with radiation therapy is usually the best option for surgical treatment. The vast and robust data which indicate better survival rates with breast conservation treatment, or BCT for short, have been discussed in other videos. You may wish to view them, and the links are provided in the description below. Here, we will be looking specifically at how surgery impacts return to work and therefore quality of life. We begin with this study conducted by a team of German doctors regarding health-related quality of life in women with paid work at the time they were diagnosed with breast cancer. In this excerpt of their article, they found that return to work, abbreviated as RTW in this article, was strongly associated with higher health-related quality of life. Return to work at 3 weeks after surgery appeared to be the factor mostly correlated with physical well-being. Having had a mastectomy, rather than BCT, interacted significantly to be a second-level associated factor with a more deteriorated physical well-being. Mastectomy, therefore, was shown to have a negative impact on physical well-being compared to BCT. Since returning to work is correlated with physical well-being, one of the aims of therapy should be to offer treatment which encourages employment and avoid treatment strategies which increase unemployment. Let us review this study where a meta-analysis was conducted. A meta-analysis is a method of calculation which combines the data from multiple studies. In this systematic review and meta-analysis, this team of doctors found that there was a significant association between unemployment and mastectomy as compared with breast-conserving surgery. This implies, therefore, that if a patient undergoes BCT, she is more likely to return to work, and this then leads to improved physical well-being. This data is corroborated by another study done on the same subject in a different geographical region, Brazil, where breast conservation surgery, or BCS for short, was associated with higher rates of return to work when compared with mastectomy. The data presented in today's video demonstrates that breast conservation treatment is associated with higher rates of returning to work, and possibly within a few weeks of having completed surgery. This, in turn, is associated with improved physical well-being. We will also recall that there is robust data supporting breast conservation treatment as conferring equivalent, possibly even superior cancer control rates when compared with mastectomy. May I therefore encourage you to consider breast conservation treatment if your doctor feels that you are eligible for the procedure. There is sound scientific and medical evidence to support good cure rates, quicker return to work, higher employment rates, and improved physical well-being when compared to mastectomy, with or without reconstruction. Thank you for watching till the end of this video. If you have found this information useful, please like, share, comment, and subscribe so that together we can empower women with the knowledge to make treatment decisions which help them live longer and live more. More such information in our next video. Join us. Until we come together again, take care.